to Central Florida may buy doctors and patients more time. Ed Highland's here now to explain what it's all about.
Well, you know, when it comes to dealing with your heart, every second can count. And so the question has plagued doctors: if a patient's arteries are clogged, is there a quick way to restore the flow of blood without resorting to open heart surgery? Well, the answer may be in a kind of temporary bypass, using techniques which have only become routine in the past 10 years. This man is having a balloon angioplasty. A thin tube is inserted into an artery through a small incision in his abdomen. Dr. Charles Curry then directs the tube to an area blocked by fatty deposits. A balloon-like bubble at the tube's end is then inflated and deflated several times, flattening out the deposits and reopening the artery. But during this procedure, there is a small chance the expanded balloon itself will block enough blood to cause a heart attack. That's where what's called a retroperfusion might save the delicate heart muscle. As these x-rays of the first retroperfusion done in Central Florida show, a second balloon is inserted into a heart vein. Blood tapped from a leg artery then flows backward through the vein.
What this particular technique accomplishes is it gives nutrition and oxygen not in the usual way that it comes down through the arteries, but in a reverse fashion through the vein.
Retroperfusion not only could lessen the chance of heart damage during a scheduled angioplasty, but may also buy time during an emergency. A heart attack victim could wait up to 24 hours with the retroperfusion balloon in place while his physician determines the best way to save his life. Now, only 100 retroperfusions have been done in this country and in France, so it's not available everywhere. The doctors in the Florida Heart Group are part of the required testing phase for the operation before it gets final FDA approval. It may be another year or more before others can offer the technique. But it's nice to know, since about half of us in this country are going to end up with some form of heart disease, that there are new techniques which could help us.
It is. I'm amazed to see that the gentleman was awake.
Yes, it's an amazing procedure, and he stays awake during the entire thing.
I just keep on eating my Brandon fiber, right?
Keep trying anyway.
All right, thanks, Ed.